Pop quiz number 7. Because Miss S continues to experience chest pain and has elevated levels of cardiac markers, the following interventions have been prescribed. Which intervention should the nurse delegate to an experienced UAP select all that apply? All right, guys, how do we treat select all that apply as true or false? And let me explain this to you. Very often, the test writer will try to trick you by putting that adjective, experienced in front of UAP. Guess what? Experienced or not, they're still an unlicensed assistive personnel. And so you have to keep that in mind when you're choosing your answer. So let's go. 1, monitoring vital signs every 2 hours. Absolutely. They can monitor vital signs. They can record and report. 2, accurately recording intake and output. Absolutely. 3, drawing blood for coagulation studies. Absolutely not. They're not licensed. And I know in some states you don't have to be licensed, but you have to be specifically trained. So unless it says that, guys, generally speaking, unlicensed assistive personnel does not draw blood. Number 5, assessing the cardiac monitor every 4 hours. Assess? Absolutely not. Unlicensed assistive personnel, they do not assess, they do not evaluate, they do not teach, they do not give medications, which leads me to 3, because I skipped 3. Administering tenecteplase IV push, that's a medication. They cannot give meds, so false. And then number 6, assisting the client to the bedside commode. Yes. They can assist patients to ambulate. They can feed patients. They can help them to get dressed. They can transport stable patients from one place to another. They can transfer equipment. They can record and report. They can do vital signs. There are lots of things that unlicensed assistive personnel can do. But giving medications, assessing, evaluating, those are none of them. They cannot do that. So the correct answer choices here, guys, are number 1, number 2, and number 6.